We're continuing on our series about longevity, how to live a longer life, but more importantly, how to stay healthy while you live that longer life. So we're talking about increasing health span overall. So longevity practice number 5 is heat therapy or thermotherapy. So saunas, red light therapy, cold plunges, we'll talk about in another podcast, tool for increasing longevity. So there are some health benefits to sauna therapy and red light therapy. That'll be a subject of health longevity practice number 6. So heating and cooling your body can have major health benefits and contribute to a longer lifespan and a longer health span. So saunas have been around many years. The Scandinavians are still big users of saunas, and much of that research on heat therapy comes from Scandinavia. So lots of studies showing that regular sauna use improves health and longevity. Health benefits from sauna include better insulin sensitivity, so lessening insulin resistance, lowering blood sugar, faster recovery from injuries, faster recovery from workouts, release of growth hormone, increased neurogenesis. You can make new brain cells from heat therapy. So creating new brain cells seems like a good idea, especially as you get older, right? Sauna bathing, lots of physiological effects. We're going to go through that. I'll show you what I'm talking about. Things that just increase longevity and health span. High temperatures from a sauna cause blood vessels to dilate. That improves circulation. It lowers blood pressure. It helps the body to remove toxins through sweating. And you reduce inflammation, a primary cause of aging, as well as the basis of most chronic disease. The heat of the sauna relaxes muscles. It improves blood flow not just to the skin, but to the muscles, and promotes relaxation, reducing stress levels. So, an effect on your cortisol, chronic stress, higher levels of inflammation, increased aging, and for certain, higher blood pressure and cortisol resistance. So, let's look at some studies. First one is clinical effects of regular dry sauna bathing, a systematic review. And we'll go through some tables that are a little bit intense looking. You don't have to look at all the picky details. So this was a search of studies from year 2000 onward. Risk of bias assessed according to Cochrane collaboration studies, blah, blah, blah. So sauna bathing, whole body thermotherapy, used in various forms for thousands of years in many parts of the world, not only for hygiene, but health and social and spiritual purposes. So modern day sauna use, traditional Finnish style sauna, as well as Turkish style hammam, Russian banya, other cultural variations. Traditional Finnish saunas are the most studied, so 5 to 20 minutes at temperatures of 80 to 100 degrees Celsius, with and without some cold plunges, maybe between sauna sessions. So let's see what the health benefits of sauna bathing, the Finnish type, can provide for you. So rather than go through all the picky details of this study, the conclusions from the authors are regular infrared and or Finnish sauna bathing. We'll talk about red light therapy coming up. Potential to provide many beneficial health benefits, especially those with cardiovascular related and rheumatological disease, athletes, improving exercise performance. And the effects may be due to increased bioavailability of nitric oxide to vascular endothelium. So nitric oxide dilates blood vessels. It's produced right in the cells lining arteries. And then once it has its effect on dilation of arterial supply, it goes away. And one of the problems with mouthwash is that you are destroying nitrates, which are used to make nitric oxide. So heat shock, protein mediated metabolic activation, immune and hormonal pathway alterations, enhanced excretions of toxins, from sweating, and we'll talk about hormesis coming up in this class as well. Insufficient evidence, however, to recommend specific types of sauna bathing for specific clinical conditions. So that's we need further studies to explore the mechanisms by which sauna bathing exerts physiologic, psychological, and metabolic effects, etc. So let's look at this study, effects of heat and cold on health, with special reference to Finnish sauna bathing. This is from May of 2018. The abstract of that is here. Here's the citation. So hormesis is challenging your human health and homeostasis with an acute traumatic event, not so traumatic that it would like hurt you, but teach your body how to deal with changes in homeostasis so that you can get back to balance. So physiologically adopting to heat and cold environments is part of the physiologic thermal body regulation mechanism of body temperature. So exposure to hotter temperatures and colder temperatures can teach your body a stress response that will keep you balanced and homeostatic. So that would be important in cardiovascular health, like we saw in the previous study. So let's look down at what sauna bathing in this study showed on cardiovascular health. So previous studies showing and suggesting positive effects of sauna bathing on cardiovascular health, 5 to 20 minutes duration a few times per week, associated with a decreased risk of sudden cardiac death, cardiovascular, and all-cause mortality. There's a citation if you want to look up that paper and look at it. It's been reported sauna bathing is associated with significantly lower risk of fatal cardiovascular disease events and all-cause mortality. Furthermore, a follow-up study of this cohort has also shown that sauna bathing lowers the risk of neurodegenerative diseases, dementia, and Alzheimer's disease risk. Also, in regard to these brain disorders, the risk reductions were substantial, of 66% for dementia and 65% risk reduction of Alzheimer's disease when sauna bathing 4 to 7 times a week is compared with subjects having only one sauna session per week. Figure 1, cumulative hazards of sudden cardiac death according to frequency and duration of Finnish sauna bathing. Okay, so this one, sauna frequency per week, cumulative hazard ratio of sudden cardiac death here on this axis. So this would be 1 time per week, 2 to 3 times per week, and 4 to 7 times a week. So the 4 to 7 times per week has a significant reduction in cumulative hazard of sudden cardiac death. And then for duration, less than 11 minutes at the top, 11 to 19 minutes in the middle, and greater than 19 minutes. You can take it too far, remember, here. So significant reduction in hazard ratio here based on duration. So it appears that 4 to 7 sauna sessions per week of at least 19 minutes is the most protective from sudden cardiac death. So the conclusion from this study, acute warm and hot temperatures are stressful, but your body, through hormesis, adopts physiologically to repetitive heat sessions, leading to improved heat tolerance and ultimately decreased mortality and reduced risks for brain disorders such as dementia and Alzheimer's disease. So similar to hypoxia, reduced oxygen levels, and or altitude, heat or cold stress could also be applied as an independent or adjunct therapy to exercise and physical activity to maintain or improve human health, particularly among those who do not want to or cannot exercise. So the best benefits in cardiovascular and all-cause mortality may be obtained by increasing physical fitness combined with sauna bathing, highlighting the fact that several lifestyle habits affect human health, and we all know that, or we should. So from this study, you have regular Finnish sauna bathing to reduce blood pressure, improved relaxation overall, increased sweating and fluid loss, reduced arterial stiffness, one of the benefits of sauna therapy for cardiovascular risk reduction, by most likely increased production of nitric oxide, which leads to improved endothelial function, lining cells of the arteries overall. So the health outcomes that may improve: decreased cardiovascular and all-cause mortality, reduced incidence of respiratory diseases, reduced incidence of Alzheimer's disease and dementia. So, are there any risks? Well, of course, but usually they involve risk of being by yourself, alcohol use or drug use while you're in a sauna. So the literature is reviewed in this article here, which I cannot pull up. It's from this journal, 2018. It's a free article, but I cannot find it. I copied and pasted this link. I copied and pasted this. I can't get it to pull up except for the abstract. So the circulatory effects of heating and subsequent cooling related to sauna bath differ with age, underlying medical condition, and use of drugs. The circulatory changes may often be beneficial, but can also prove dangerous. So in this study, 2,000 sauna bathers were followed for 20 years in a Finnish population study. The investigators recently reported health benefits of abundant sauna use for individuals concerning hypertension, ischemic heart disease, dementia, and certain pulmonary diseases. So that was the study that we just looked at that reviewed that. Others have recommended the use of sauna for patients with heart failure. Fatal events are very uncommon and often linked to the use of alcohol to ischemic heart disease events, angina and heart attack, and then bathing by yourself. So basically it says, ask your doctor, make sure that your ischemic heart disease is stable, you're not having a changing and potentially heart attack inducing events going on in your vessels. Stay away from alcohol in the sauna and stay away from using any other mind altering substance. And they review the medical conditions in which heat therapy should be avoided, but I can't find it. I was interested to see what they said about that. Heat therapy or thermotherapy improves your health in a variety of ways, with those caveats of being careful with people with unstable angina, as well as alcohol use and drug use, and being by yourself. And by the Finnish studies, it would be 4 to 7 times per week, 5 to 20 minutes, but the best at about 19 minutes per session from 80 to 100 degrees Fahrenheit. So give it a shot and see how you feel. And let me know in the comments if you tried it and it's made a difference in your life. Of course, we can't talk about your longevity and health span until we talk about this 20 or 30 years from now. Have a great day. I'll talk to you later. Bye.